Good evening, everyone. Welcome to SS Medical Classes. I am Dr. Ritik, and today we are going to learn about MEN syndrome, also known as multiple endocrine neoplasia syndrome. And let's learn about what we are going to learn in this topic today. We are going to learn about the definition, obviously, the types of MEN syndrome, clinical presentations which are seen, and the genetics related to various types of MEN syndrome. As the name suggests, MEN syndrome, multiple endocrine neoplasia. It involves it involves multiple endocrine glands. That's why it is named as multiple endocrine neoplasia. And here are the various types of MEN syndrome listed. MEN 1, type MEN 2A, type MEN 2B, which was previously known as MEN 3, and MEN 4. Okay, let's begin our discussion by learning about MEN 1 syndrome. It is also known as Wermer syndrome. And the genes which are related to the pathology of MEN 1 syndrome, the genes are MEN 1 gene, and it is located on chromosome number 11. Now let's see which are the endocrine glands which are involved in MEN 1 syndrome. First is pituitary gland. And the other gland which is involved is parathyroid gland. And the third gland which is involved is pancreas. Okay. Now the most common tumor which is involved in pituitary gland, which occurs in pituitary gland in MEN 1 syndrome, is prolactinoma, which is a prolactin hormone secreting tumor. Prolactinoma. And it can be seen in about 30 to 40% cases of MEN 1 syndrome. Okay. Now about the parathyroid gland. Parathyroid hyperplasia or parathyroid adenoma is seen in MEN 1 syndrome. Parathyroid adenoma or hyperplasia. It can be seen in about 90% cases of MEN 1 syndrome. And the involvement of pancreas, the most common functioning tumor. Guys, focus on the word most common functioning tumor is gastrinoma. Gastrinoma, yes, is a tumor of G cells. G cells usually occur in stomach and duodenum, but they are also present in pancreas during the embryological development stages. And the second most common functioning tumor of pancreas in MEN 1 syndrome will be, insulinoma, the insulin secreting tumor. And these can be seen in about 30 to 70% cases. Okay guys, we are done with the MEN 1 syndrome. Now let's go for the MEN 2A syndrome. सर ये बीटा सेल्स जो होती हैं हमारी पैनक्रियाज में उनसे ओरिजिनेट होता है. Okay, now let's focus on MEN 2B syndrome. MEN 2A, sorry. Men 2A syndrome is also known as, yes, Sippel syndrome. And the genes which are involved are, yes, RET gene, RET, RET gene, and it is located on RET gene. It is located on, yes, chromosome number 10. The men gene which, in men 1A syndrome, it was located on chromosome number 11, and the red gene, yes, it is located on chromosome number 10. Now let's see what are the glands which are involved in men 2A syndrome. Yes, we will see the similarities and differences from men 1 and men 3 syndrome. Okay, first of all, it's pheochromocytoma. Yes, okay, guys, what is pheochromocytoma? It is the tumor of adrenal medulla. As we all know, catecholamines are secreted by adrenal medulla. So the norepinephrine and epinephrine, these are the catecholamines which are secreted by adrenal medulla. And this the pheochromocytoma is the tumor of adrenal medulla. Yes, but the presentation in men 2A syndrome will be bilateral and mostly extraadrenal, which means that this tumor will be found outside of the adrenal gland. Extraadrenal. Yes, we all know that pheochromocytoma, it arises, chromocytoma is from chromophene-like cells. Okay. The other other gland which is involved in men 2A is thyroid gland. Thyroid gland. Yes. And the carcinoma which is commonly seen in men 2A, which is related to thyroid gland, is medullary carcinoma of thyroid. Please remember it, medullary carcinoma. And the occurrence of this carcinoma is almost about 100%, which means in men 2A syndrome, medullary carcinoma of thyroid will be seen in almost every case of men 2A. Okay. And now the third gland which is involved, yes, is, yes, parathyroid glands. And so which means parathyroid hyperplasia will be seen in men 1 syndrome and also in men 2A syndrome. Okay, guys. So let's again go through the slide of men 1 syndrome so we can compare it with men 2A syndrome. See, pituitary gland, parathyroid gland, and pancreas were involved in men 1, and the adrenal glands as pheochromocytoma obviously, and thyroid gland and parathyroid gland, they are involved in men 2A syndrome. Okay, guys. Now let's move our discussion towards men 2B syndrome. Men 2B syndrome, it was earlier known as men 3 syndrome. Okay, but nowadays it is renamed to men 2B syndrome. The genetics, they are same as men 2A syndrome, which was, yes, RET gene on chromosome number, yes, chromosome number 10. Now the important clinical presentations which are found in men 2B syndrome will be, okay, let's start with the important ones. Have you guys noticed that there is a trend like in men 1, the organs which were involved, they were starting from the letter P, and as we move towards men 2A, the a tumor which started from the letter M came across, and now let's see how many M's are coming in men 2B syndrome. Okay. Medullary CA of, yes, thyroid, Marfanoid habitus. These are the features which are seen in men 2B syndrome. Yes, medullary sea of thyroid, Marfanoid habitus, and mucosal neuromas. Yes, and megacolon and adulated corneal nerve fibers. And another important feature of men 2B will be, yes, which was also seen in men 2A, pheochromocytoma. Yes, pheochromocytoma. So now we have similarities between men 2A and 2B also, which was carcinoma of thyroid and pheochromocytoma. Okay, let's move toward the men 4 syndrome. The genetics which are involved in men 4 syndrome, the gene which is CDK1NB gene. Okay, guys. What does the mutation in this gene does is it decreases the production of P27 protein. And what does P27 protein does? Uh, okay. It involves CDK1NB gene which decreases the P27 protein, and P27 protein is an important protein which regulates the cell cycle, and that's why there is an irregularity in the cell cycle which causes neoplasias in several glands of a human body. Now the glands which are involved in men 4 are same as like some of the glands are same like men 1 is are yes pituitary gland. Okay, guys, as we have learnt about, as pituitary gland is involved in two of the men syndrome, men 1 and men 4. The part of pituitary gland which is involved is anterior pituitary in both the endocrine neoplasia, yes, men 1 and men 4. All right, and yes, the other was pancreas again. And the special thing about men 4 syndrome is, which we have not learned in any of the men syndrome in men 1, men 2A and men 2B, is the genital tumors. Okay, guys, genitourinary tumors are seen in men 4 syndrome. This is a important point to remember. Genitourinary tumors. Yes, they are seen in men 4 syndrome. Okay, guys, now here is a summary of men 1, men 2A and men 2B. The organs involved in men 1, pituitary, parathyroid and pancreas. In men 2A, parathyroid, medullary thyroid and pheochromocytoma, the involvement of adrenal gland. Men 2B, mucosal neuromas, Marfanoid habitus, medullary thyroid carcinoma, pheochromocytoma. Okay. Now let's focus on the comparison in a tabulated form. Men 1 gene. Let's first go about the genetic causes. Men 1 syndrome. It is the most common men syndrome, and the men 4 is the rarest form of men syndrome. Now let's learn about the genetic cause. Men 1 gene in men 1 syndrome, red gene in men 2A, 2B, and CDKN1B gene in men 4. Now let's learn about the prevalence. Men 1 being the most common is the most prevalent, and men 4 being the rarest is the rare. And the age of onset, men 1 can occur in any age group, men 2A can also occur in any age group, men 4 can also occur in any age group. the point to focus here is meant to be. It occurs in childhood or adolescent. As we have gone through the glands involved several times, let's go through them once again. The glands involved are parathyroid, pancreas, and pituitary in men 1, and pheochromocytoma, parathyroid, and thyroid, medullary thyroid. They are involved in men 2A syndrome. Men 2B involves pheochromocytoma, medullary thyroid carcinoma, marfanoid habitus, mucosal neuromas of lips and tongue, and megacolon. And men 4 involves parathyroid, pancreas, pituitary, and also the genitourinary tumors. Now the symptoms, as the glands which are involved in various men syndrome, we can tabulate the symptoms according to that. Like the parathyroids which are involved in men 1, it causes hyperparathyroidism, medullary thyroid cancers, they occurs in men 2B, marfanoid features and neuromas, they occur in men 2B, and again hyperparathyroidism again occurs in men 4. These are the several lab findings which are seen in different men syndrome. Elevated calcium levels and increased parathyroid hormone levels are seen in men 1, and as the thyroid gland is involved in men 2A and 2B, we can see elevated calcitonin levels, and in men 2B pheochromocytoma was there, so we see increased catecholamines. All right, and another important point to be noted here is that the inheritance of all the men syndrome is autosomal dominant. Yes guys, again autosomal dominant. And let's see what is the prognosis of various men syndromes. Men 1 generally has a good prognosis if diagnosed early and treated early. Okay, now men 2B has a poor prognosis, and men 4 and men 2A, they have generally a good prognosis. Okay guys, that's all from my side about syndromes, multiple endocrine neoplasias. Okay guys, that's all. Thank you from my side. And if the content was useful to you, please like the video, share the video, and subscribe the channel. So when we upload another video, you are notified. Thank you so much.